if in fact, and you can do this starting today, concentrate on your sleep hygiene, your entire world can change.
It's true. Yep.
Because everything that's restorative actually happens when you're asleep. Nothing restorative happens when you're awake. Stress happens when you're awake. Physical exertion happens when you're awake. Mental strain happens when you're awake. At night, if you can get long enough, deep enough, high enough quality of sleep, the lymphatic drainage of your brain will wash out the trash from the day.
Because that only happens when you're sleeping.
Correct. And the lymphatic system will drain the rest of your body. If, in fact, you wake up and you feel worse than when you went to bed, none of that happened. If you're the person that has to get up in the middle of the night to pee who's female, you need counseling. You should not be doing that. You have too much cortisol release. It's just waking you up. Or you're drinking fluid or wine before bed, which is like classic behavior, right? You're trying to unwind, so you have a glass of wine.
I just want to interject there because I hear a lot of people, a lot of women that I work with say they're getting up at night to pee. Oh yeah, I just get up at night to pee every night. It's just, normal. So first thing is to cut out drinking wine or drinking liquids in the evening. Secondly is what?
Yeah, so the way we do it for patients, because we have very, very big asks. Like when I ask a patient to do this, you have to be fully committed to this. So you need to stop eating 3 hours before bed. Stop drinking 2 hours before bed. Get off your screens, tablets, whatever garbage it is you do before bed, and try to get in the frame of mind of we're going to go to sleep and we're not going to get up to go pee because you're not a male with a prostate that's the size of a grapefruit. Now that's a problem. Females, it's like fluid too close to bedtime, alcohol too close to bedtime. Like those things are just acting as reasons to then wake you up, so you have to go to bed. It shouldn't happen. And so you have to get the room cool enough. Now, women need a different temperature than men, obviously. And if you have a sensitivity to noise, you need to play some white noise or wear some, whatever headphone that aligns with your beliefs, to block noise. Like I have to wear headphones because I have, 2 kids. I have a wife. We have a blind pug that wanders around stomping on the wood floors. So, and I wear a sleep mask. So, and a CPAP mask. So I look like a freak when I go to bed, but I don't.
Do you tape your mouth as well?
No, because it's harder for me like to get enough oxygen just through my nose. So I have a mask. So
yes, you mentioned earlier.
Yeah, I would if I probably could get away with it, just mouth tape, but I can't. It's seemingly like sometimes I wake up and I don't feel very good. So that's to me, I'm not getting like enough, either oxygenation or there's something going on. I don't know what. And I haven't been willing to retest my sleep apnea because like I know I have a pretty bad problem with sleep apnea. So I'm not like it's not just resolved. It didn't go away. And I'm not overweight. I don't have like a weird, problem with my neck. It's just I grinded my teeth for a long time operating. So I had to have my teeth height restored and then have a little bit of a narrow airway. But every night I go to bed, typically between like 9 and 10. I don't deviate.
Right.
And so I get up between like 4:30 and 5:30 every day. And, I know what my HRV is. I know how long I've been in bed. And I get up and I'm consistent. It doesn't really matter what day of the week it is. That's what I'm doing. And that just helps. I don't do a good job of going out and getting sunlight in the morning because I'm usually at work before the sun's up. And I don't break and go out all the time and walk around, which I should, but I don't. So I could do better like that. That helps reset your circadian rhythm. And then when you're after surgery, you cannot fast. So you have to get out of that habit before surgery. it's not the time to start a new habit after surgery. It's one to start before you ever go through the process. So if you're fasting, um, you need to get into a habit of eating and responding to that satiety level, and then going throughout a day, because it's like GLP-1s, Jane. Everybody's like obviously using, who needs them, but then I have some people just microdosing, doing all these other things. So I tell them, like, look, you can't do that and have me operate on you. Why? Blah blah blah. I'm like, because I need you to be able to eat.
And know when you need to eat.
Right. Right.
Yeah.
Does that, I try to do things that make sense, right? Like, just think, like,
Mm,
if that drug burns fat and makes it so you're not hungry and you think that you're full, that doesn't really work for me.
mhm.
And the anesthesia guidelines are you got to be off in 2 weeks, which is, to me, not enough. I always give people, like, I want more runway, not less.
Right.
Everything I do, I want to be, I have to be, I'm a micromanager, basically. If the stuff, I know what works, I don't, you know,
And you want your patients to have success from the surgery too. So you want to set them up for that.
yeah, all those drugs work really well. Like, I never thought there would be a drug that changed behavior, and then this one comes along and it
Mm,
changes behavior. So any drug that changes behavior is by far the most powerful drug you could ever have. So anything that controls binge eating, addiction, lowers inflammation, burns fat, all these other things that we don't even know it does yet, which I'm sure will come to light at some point. That's a pretty powerful tool, and it should have a lot of respect.
mhm.
So I don't really want you on it if you think, um, I'm your surgeon. Basically, it doesn't. You know, it works too well. It's not like
Mhm.
taking a blood pressure medicine. It's not like taking, not a blood pressure, a blood thinner that we can turn off and on very easily. This is a very powerful tool that changes your perception of what you're doing. So I don't.
Mhm.
Yeah,
So you have a process before and
yeah,
after surgery, which incorporates a lot of lifestyle things, which are really within someone's power to do. But
yeah,
these things help set people up for success.
yeah. I think most of us have some pretty poor habits. So most of it's just trying to
Mhm.
make a series of small changes that have a cumulatively large effect. Right, tiny habits, and
It's
just
exactly what I teach.
change the little ones, and the
Yeah.
ones that people fight me on, this protein thing. You would think I'm trying to kill them or something with protein.
Hmm.
Like, it's the
So
most important macro.
you were saying earlier, I think when we started on the sleep topic, that you need to, in order to sleep better, you need to get enough protein. Was that the correlation, or did I get that wrong?
Yeah, so think of it like this: like, why do babies eat so much and sleep so much? Right. So if we're, and I'm sorry, you highlighted why, because they need to grow. You do all this growth, they have all this growth, but it's because they consume all these calories and then they rest. If we want to think of it, the parasympathetic state is rest and digest, right? The sympathetic state is fight or flight. So I cause sympathetic activation. You've probably never interviewed anybody who causes more than I do.
Because of the surgery.
Right. So our job is to get you prepared and in a lower cortisol state before surgery, because I'm going to cause a big burst, and
Right. So,
the longer you stay in it, the worse it is.
so you, in terms of like a bucket of how much we can take, if they're already high, then you're going to do a whole lot more. So you want to bring that
Right.
down before surgery.
Right.
Okay.
And all my
Makes sense.
patients are high already. Right. They
Yeah.
already have a
So many
lot
people.
of chronic inflammation. Right.
Yeah. Yeah. And they've got, your patients have the inflammation as well.
Right. Right.
Right.
Because
Uh,
you can have the exact same problems that I deal with and not have implants. We've all seen these patients.
Chronic inflammation.
Right. So that's why, like, okay, so anybody can have that problem. I gave you the reasons why. It's genetics, exposure, poor gut health, sensitivities to all sorts of things, poor hormonal balance, also can be attributed to genetics, also can be attributed to diet, also can be attributed to products you apply to your skin. So you have to be super diligent. Everybody listen. You have to be super diligent to the fluids you put in your body, the quality. Like think of like filtered water. The quality of the food to best of your ability. It's very hard. And then everything you put on your body. And
Hmm.
women use the most products by far.
Most
And
chemical
then
exposure.
the number one thing is BPA. And BPA has been around since the 50s. Introduction of plastics into the US economy, basically. That is very problematic. So just
Yeah.
scrutinize what you put in and on your body.